Patellofemoral pain in runners. So what are we talking about today? We're talking about pain on the back of the kneecap. This problem, patellofemoral pain, is so common in runners that they actually often call it runner's knee. So runner's knee, aka patellofemoral pain, we're talking about pain on the back of the kneecap. So the kneecap is called the patella and your thigh bone is called the femur. So the joint between the two, the articulation between the two, is called the patellofemoral joint. And on the back of the kneecap, we have cartilage. And underneath that cartilage, we have what we call subchondral bone. And it's that subchondral bone on the back of the kneecap we believe is what causes the pain in patellofemoral pain. And runners will often describe this as feeling like the pain is actually behind their kneecap. They feel like a sort of sharp pain behind their kneecap, but also it can be felt as a sort of diffuse or vague pain, generally in the front of the knee. And with it being in the front of the knee, this has led to the term anterior knee pain sometimes being used, but that's a very vague term because anterior just means front. So anterior knee pain just means front of knee pain. Patellofemoral pain, when it is the back of the kneecap causing the pain, is a little bit more specific to the condition we're talking about. What happens as we're running, as we're landing, our knee bends to maybe 20 to 40 degrees as we land, and the quadriceps muscle contracts to stop our knee buckling underneath us. And when it contracts, it pulls the kneecap, and the kneecap then presses onto the thigh bone, the femur. The patella is like a floating board within the tendon of the quadriceps muscle, and it's there to protect that tendon and stop it from fraying and breaking. So this is actually the function of the kneecap, is to be that articulating surface so that the tendon doesn't fray. So it's supposed to push against the femur. That's actually what it's there for. Now, we used to believe that pain coming in that region on the back of the kneecap was entirely due to maltracking, where it was believed that the kneecap was tracking slightly out to the side within the groove, and that led to increased contact pressures, which led to pain on the back of the kneecap due to the increased pressure. Now, it's not quite so simple, unfortunately. It does seem that patella maltracking, as they call it, so not tracking in quite the right alignment within the groove, is part of the problem, but it's not always there. So you can have normal tracking and still have pain on the back of your kneecap. You can also have pain on the back of your kneecap when you do have maltracking as well. So we do know that it is part of the clinical picture, but it's not the whole story, and we don't necessarily need to address the tracking issue in order to address the problem. And that brings us to the evidence that we have to date on patellofemoral pain and what's the most effective ways to actually treat it when we have this problem. And there is quite a lot of research on this problem in runners because it is so common in runners. So we do have some decent evidence that we can look at, and there was some clinical practice guidelines produced by Dr. Rich Willey a few years ago for physical therapists, and they were really helpful because they looked at all the evidence to date and said, hey guys, this is what you should work on. These things have the best evidence. These other things, they don't have so much evidence, so focus on these things. And what they found that was the most impactful in terms of actually reducing pain and increasing the ability to run among people with patellofemoral pain. And in fairness, the research that they looked at wasn't just on runners, it was on all types of people. But when they looked at it, they found that getting stronger by particularly strengthening the quadriceps and the gluteal muscles did seem to be the most effective intervention. So if you have patellofemoral pain, getting stronger is your first port of call, and this is what you should address and spend most of your time on. And what they also noticed was that the way you get stronger, so using things like compound lifts, so this is like squats, lunges, deadlifts, split squats, where you're moving multiple body parts at the same time, very functional movements, very heavy. These seem to be more effective than more isolated strength exercises, think clams, core work, that kind of thing. They also found that improving your running technique was helpful, and we've spent lots of time talking about that in other parts of the podcast, so we'll not go into that right now, but essentially just improving your running technique does seem to be helpful in terms of reducing the stress on the knees and can help reduce your risk of continuing to have this problem and can help you get rid of it. So there you primary sort of long-term objectives with the patellofemoral pain. The other couple of things that you can also look at helping are taping. So using taping, KT tape or rigid strapping tape to put on the knee, just put it on YouTube. There's lots of shaping techniques for knee pain with running out there. There isn't one that's sort of like a go-to that's awesome. There's different methods. Some use the stretchy KT tape. Some use like old school sort of rigid tape. And there's a lot of techniques by a researcher called McConnell that focused on this. Really, if you try a technique and you find it helpful for your knee pain, then it's worth doing until you get past the knee pain through applying the long-term interventions like the strength training and the running technique work we just talked about. If you put the taping on and it doesn't help, it's not the end of the world, right? You still focus on the other things that'll get you out of the situation. And it's also the same with orthotics. So putting orthotics in your shoes, we've had episodes of the podcast specifically on this before, does seem to be helpful for certain people. So if they have patellofemoral pain, they put orthotics in. Some people, they will see significant improvements. A lot won't. If you find it does actually help with the knee pain, that can be helpful, makes the rehab journey a little bit easier. What they did find in that review is that a lot of the mainstay treatments that are thankfully becoming less the go-to for runners who are seeking like physical therapy, athletic therapy, this kind of stuff for treatment, a lot of the old school stuff, so manual therapy, dry needling, electrical stimulation, laser ultrasound, and other such things, there's not much evidence to say that they actually have much effect. And these are very passive treatments, right? Trying to do something to your knee to make it feel better. We want to focus more on the active things, doing something actively yourself to become stronger, more resilient, and more robust. So that's where the strength training, running technique, biomechanic work, that is seemingly more effective than things that are done to you, like, you know, manual therapy or electrical stimulation or other such things where you, ultrasound, things where you're doing something to the knee. And that's why if you have patellofemoral pain, we want to address it in the same way that we address almost all running related injuries, which is to focus on the three critical components. So at the bottom of our pyramid, we have resilience. In the middle, we have strength. And at the top of our pyramid, we have form or biomechanics. And we want to attack things in that order. So resilience is using running as the rehab. This is doing the amount of running each week that is just the correct dose to stimulate that subchondral bone and the cartilage on the back of the kneecap to adapt, become stronger, more resilient. Not so much that you are irritating it, making it more painful. Not so little that you are not providing any stimulus for it to become stronger. Just the right amount, which will be different for every person with every condition at different times. So as your knee improves, you can run more, you can run faster, you can run longer. But earlier on in your journey, you can run less. You have to take more walk breaks. You have to break it up into more runs per week. So that's how you use running as the rehab to stimulate the back of the kneecap to become stronger and more resilient. And then the strength, which is in the middle of the pyramid, this is where we use the research we have available. We know that getting stronger in our glutes and our quadriceps helps. We know that compound lifting like squats and deadlifts and lunges seem to be more effective at reducing patellofemoral pain. So we're going to focus on them. And then finally, we're going to work on our form and our biomechanics. So particularly in our running, we're going to look at things like running with a higher cadence. So we have more steps per minute, less impact per step. We're going to look at avoiding overstriding because that will tend to make us land with a straighter knee, which can make it more difficult to absorb the impact. It'll be absorbed more quickly. We want to absorb it more slowly by landing with more flexed knee, which we can do by avoiding overstriding. Again, we have other episodes that go into these things in more detail. So these are the strategies that we are going to use to address patellofemoral pain in endurance runners. If you're having this problem and you need some help to get past it, obviously we'd love to help you. Just click the link in the description. As always, book a call, let's have a chat, see if we can get you out of this situation.